welcome back to my channel. My name is Emma. If you don't know me, today I'm here with my cousin Gabby.
Hey.
And today she is practicing to be, practicing on me to be a nurse. So we're recording on her iPad how to, for her class on, well, not on Zoom, but we are just recording it, and then her whole class will see later. And so, yeah, let's get on to this video. 3, 2, 1.
You ready?
Yeah.
Okay. Hey, Emma.
Hello.
Hi, Emma. My name's Gabby. I'll be your nurse today.
Okay.
So the reason why I'm here is I'm going to be performing a physical assessment on you, which basically means I'm going to be looking and touching different areas of your body. I'll guide you through it. It should take about only 20 minutes. Do you have any questions for me?
No.
No? Okay, good. All right, so I've already gathered the doctor's orders. I've already gathered my supplies. I'm going to close the curtain for patient privacy, wash my hands according to CDC guidelines. Can you tell me your full name and date of birth?
Emma Sophia Zabala and 11/11/11.
Okay, good. Thank you, Emma. Okay, Emma, can you tell me what day it is?
It is Sunday.
Okay, can you tell me where you are?
I'm at the doctor's office.
Can you tell me where you're here?
I'm here because I need to see the doctor.
Okay, good. So my patient's alert and orange ×4. Do you have any allergies?
No.
Okay, good. So my patient is not in distress, their hygiene is good, mood is appropriate, and they're dressed appropriately for the occasion. So Emma, looks like they've already taken your vitals. They are within normal limits. Do you have any pain right now?
No.
No? Okay, good. So now I'm going to be inspecting your head, so I'm looking for any bumps, bruises, any lesions, infestations. Do you have any tenderness or pain?
No.
No? Okay, good. Now I'm going into her skin, so her skin is intact. It is a light brown complexion. I don't see no redness, no lesions, inflammation, anything like that. Her skin is warm and dry to touch. Good. Now I'm going to go into your ears. So her ears, her skin's intact, no inflammation, redness, or discharge. Okay. Do you have any tenderness or pain?
No.
Okay, good. So skin's intact. No, I'm looking for any lesions, redness, or a drainage, tenderness, or pain?
No.
Good. All right. Now I'm going to go into your nose. So it is midline, and I see that its skin's intact. So look up for me. Nasal mucosa, it's light pink. I don't see no polyps, no redness, irritation, or any drainage. Okay, you look right behind me. So her lips are smooth, round, and pink. Can you smile for me? Her smile is symmetrical, and I see that there's no cracking. Open up your mouth for me to that. Okay, so oral mucosa is light pink. I don't see no exudate, no lesions, no drainage. Her tongue is rough, hard palate's intact, soft palate's intact. Stick out your tongue, say ah. Uvula rises midline, and her tonsils are 2+. Good. Now stick out, put it out. Good. Okay. So I don't see any inflammation, no lesions, exudate, no discharge. Okay, good. So her teeth are pearly white, and her gums fit around the teeth. So now I'm going to go into your neck. So there's no redness. I don't see any inflammations, lesions, or scars. I'm going to assess her trachea. Trachea is midline. Good. Now I'm going to assess her thyroid gland. So can you turn it a little bit around for me? Okay. So her thyroid gland. I don't feel any, no nodules. It's not enlarged. Can you swallow for me? Okay, so thyroid gland is movable. You can come back. So again, I'm going to look for her lymph nodes. They're not visible right now, so I'm going to be touching and let me know if you have any tenderness or pain. So if you're preauricular, postauricular, occipital, parotid, retropharyngeal, submandibular, submental, anterior cervical, posterior cervical, supraclavicular, they were non-palpable, non-tender, they're non-visible. You didn't have any tenderness or pain?
Yes, I did not.
Okay, now. Okay, so now I'm going to assess for her carotid. So strong regular rhythm 2+, strong regular rhythm 2+. Now I'm going to check to see if you have any bruit. Okay. Hold your breath for me. Okay, good. Other side. Okay, good. So I didn't hear any bruit, so now I'm going to assess for her apical pulse, along with her carotid. So her apical pulse is left midclavicular, 5th intercostal space. They're in sync, and I don't hear any deficiencies. Good. Now I'm going to check for JVD, so I want you to lean back on your pillow for me. Okay. So I don't see no JVD. I don't really see any pulsations. Okay, you can come back up. So we skip section 3, going straight into section 4. So normally her gown would be open, or her shirt would be off. I see equal chest rise, no use of accessory muscles. Her anterior posterior diameter is less than the transverse diameter, the ratio of 1 to 2. This is for her skin turgor. Alright, so skin turgor She has good skin turgor and no skin temptation. Okay. Now I'm gonna assess for your chest expansion. So I'm using the butterfly method. Breathe in for me and out. Good. Now behind. Breathe in and out. Good. So she had equal outward chest rise. Okay, good. Now we're gonna assess for your pulsation. So bring out your wrist up for me like that. So these are brachial. So we have regular rhythm, strong 2+, radial, regular rhythm, strong 2+. Good. Now we're gonna assess for your range of motion and your strength. So push up your arms, back down. Okay, again, resistance again. Back down. Good. Now bring out your arms like this for me. Bend your elbows. Good. Now back out like this. Okay. Bring your wrists up, down, bridge fingers, back together. And now bring them out again. Push up, down. Okay. With your hands. Push up, down. Good. Now squeeze my fingers. Good. So she has good range of motion in her upper extremities. Bilaterally throughout, so 2+. Good. Now I'm going to assist for your cap refills. Let me see your fingernails. Good. All right. So now we're going to check for your reflexes. So I have your reflex hammer. So here we're going to look at the triceps. Kind of loosen up for me. Relax. Triceps. Then we have your biceps. Brachioradialis. Next one. Triceps. Biceps. Brachioradialis. Good. So she has strong reflexes in her upper extremities, 2+ bilaterally. Now we're going to go into her patellar. Okay, good. So she has in her lower extremities strong reflexes, 2+ bilaterally. Okay, good. Now I'm going to listen to your heart sounds. Okay. So we're going to start with the aortic. Okay. So aortic is right sternal border, second intercostal space, and S2 is greater than S1. And then we're going to go to pulmonic, which is the left sternal border, second intercostal space. S2 is greater than S1. Erb's point, which is left sternal border, third intercostal space. S1 equals S2. Tricuspid, which is left sternal border, fourth intercostal space. And then S1 is greater than S2. And now for our apical pulse, I have to feel it. So left sternal border, mid-clavicular, fifth intercostal space. I had to fully feel it for about a minute. It's regular rhythm, strong pulse. 2+. Now I would listen to it normally for a full minute. Okay. Left mid-clavicular, fifth intercostal space. Okay. So I didn't hear any, so, it was just a regular rhythm. So throughout, regular rhythm, heart sounds, no S3, no S4s, no heart murmurs, and no skipped heartbeats. So I'm going to listen to your lungs, but for now, I see that she has good chest expansion, she has no labored breathing, and she has a regular breathing rate. So every time you want to see my stethoscope, kind of feel it on your skin, take a big deep breath for me, and out, okay? So I'm going to go mid-clavicular, so deep breath in. I'm going to the lateral sides. More time. Good. And now you can turn around for me. So I'm going to the posterior side. Again, avoiding the bone. Breathe in. Again. 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 One more time. So she had clear breath sounds throughout. No adventitious sounds, vesicular sounds throughout. Okay, now I'm going to assess your abdomen. So I need you to be laying down a little bit for me. Just rest your head right here. And then, can you bend up your knees for me? Okay, so we're going to start off with some questions. So when was the last time you had a bowel movement?
It was like about 3 hours ago.
What was the color?
Brown.
Okay, was it formed? Was it liquidy?
It was formed.
Okay, good. Did it hurt?
No.
Was there any blood in it?
No.
Okay, good. When was the last time you urinated?
The last time I urinated was like around the same time I went to
The first one? Okay.
Yes.
What was the color? Was it cloudy, clear?
It was just like yellowish, clearish.
Okay. Did it have any blood in it?
No.
Did it hurt?
No.
Did it burn?
No.
Just so good. No signs of infection. So now I'm going to assess her abdomen. So on this side, on the side of the foot, the foot of the bed, and then obviously I'd assess on the other side as well. I didn't see any masses. I didn't see no dissension, no bulges, no drainage. She didn't have any tubing. And no redness or anything like that. Her umbilicus is midline and it's inverted. Okay. So now I'm going to listen to your tummy sounds, basically. So her bow sounds. So I'm going to start at the right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. So you hear gurgling and rumbling. She has active bow sounds. So now I'm going to listen to her arteries. Her renal arteries. So I'm starting with the bell. So start at the aorta. And then we have the right renal artery, the right iliac artery, the right femoral artery, the left renal artery, the left iliac artery, and the left femoral artery. Good. I didn't hear any bruit, so now I'm going to percuss. So, the tympanic sounds throughout. Now I'm going to palpate. Okay, I didn't feel any bulges or anything. No masses. Okay, now you can sit up for me. Okay, now I'm going to assess her legs. Kind of bring a little bit forward. Assess her legs. Her skin is intact. It's a light brown complexion. No redness, no inflammation. Back here in the back. I see that her, what are these called again? Calves. There's no redness, no inflammation. Okay, good. So I'm going to check your pulses. Okay. Oh, again, I forgot to say that she has warm skin and it's dry to touch. So we have popliteal. We have the tibialis. I don't remember. I just know it's posterior tibialis and dorsalis pedis. There you go. Dorsalis pedis and posterior tibialis. Okay, good. So her pulses were regular rhythm, strong 2+. Okay, good. So now I'm going to test for your range of motion. So lift your legs up for me. Back down. Okay. Again. Up. Up. Down. Okay, good. Now your feet up. Down. Okay. Now spread your legs. Back together. So she has good range of motion in her lower extremities bilaterally 2+. Now I'm going to assess for her cap refill. Okay, so it's less than 2 seconds. So, okay, that's it.
Alrighty.
We're good.
Amazing.
That was a
Guys,
lot.
so we finished doing it. We're going to say bye because, well, we finished
It's over.
doing it. And yeah. So guys, we have, guys, before, how do you, okay. Guys, hit the like button, hit the subscribe button, and hit the bell for you to be notified for all of my videos. So guys, thank you for watching this video. Bye.